MiniTC Microfat is a finely processed microfat which can be injected with very fine needles up to maybe even a gauge 24. With that, the processing is very gentle of the lipoaspirate to the microfat, which means there is a high cell viability, almost 92% and more. The cell counts are pretty high in regards to the multinucleated cells and the stromal cells that are present, and definitely the MiniTC Microfat is of the highest quality. Now the good part about this microfat is it can be used in conjunction with a lot of other biologics that doctors already use. Example being platelet-rich plasma or PRP, or bone marrow aspirate as well. For the cosmetic surgeons, the med spas as well as aesthetic practices, it can act as a biological filler. So instead of using synthetic fillers, you can use microfat. For a lot of orthopedic practices doing orthobiologics, it can be used as a orthobiologic instead of doing bone marrows or other PRP systems, and also it can be combined with either of the two. And therefore, I think doctors, including orthopedics, as well as on the aesthetic side, are going to love MiniTC Microfat. What you're doing is you're using your own tissue, so that decreases any chances of infection or rejection of the tissue.
But also from a patient perspective, I think the microfat injection is really quite well tolerated, and my patients have had really nice outcomes, and I think that everybody, including myself, has been very pleasantly surprised with the significant benefit that we're seeing from a lifestyle perspective, from a pain relief perspective.